Groundbreaking data have been presented in the early-stage lung cancer setting. Stefan Zimmermann, from University Hospital in Lausanne, shows how they will impact on clinical practice.
This study is really opening a new era in the treatment of lung cancer because it's the first time that we actually see the use of checkpoint inhibitors in the neoadjuvant setting. And what's been really nicely shown in this study is that immunotherapy works, it's safe and feasible. So the only safety issue was one patient developed tumor cavitation and went to surgery earlier than expected, but that's usually more of a good sign. It did not delay surgery, and it was associated with a very high rate of pathological complete response. Another important and very interesting aspect of the study was that actually the radiology vastly underestimated the response that was seen with this treatment. So I think the use of only CT scan assessment is not a good surrogate marker for what really happens when we treat these patients with the checkpoint inhibitors. We know that they are expanding the study, so another cohort will get a third infusion of nivolumab, and there's still another cohort which will get a combination of ipilimumab and nivolumab, also in the neoadjuvant setting. So this is really something that we have to stay tuned for.
Adapting clinical trials to tumor biology is an emerging concept in oncology. Carmen Criscitiello from the European Institute of Oncology in Milan highlights which challenges are on the horizon.
It's very important to adapt the way in which we try to find drugs, find targets, but accordingly it will be important to adapt the way in which we design and conduct clinical trials. And this is something, of course, more challenging for everybody who's involved in this process. It's more challenging for patients, for clinicians, for investigators, because it will require different time points in which we might be involved in different decisions and different roads to follow. But I think that this is definitely the right way to move forward in order to finally try the way to optimize our knowledge. We are not there yet, but this is the right way.